Hi, this is Jürgen Rasmussen. Welcome to the Provocative Hypnosis Blog. In today's episode, I'd like to talk about the lessons I learned from working with a schizophrenic client, and a client that by most standards would have been considered dull or psychologically not very sophisticated or unintelligent, so to speak. Now, the reason I'm making this video is because there's a lot of emphasis among agents of change, among hypnotherapists, psychotherapists, coaches, about working within your so-called scope of practice, and a lot of people advocate for a evidence-based approach, firmly rooted in current scientific findings. Now, while I have a lot of sympathy with the scientific method, and while I like to keep myself as updated as I can into the current scientific research, I think this is a model you should hold pretty lightly, and I think there's a strong argument to be made by working outside of any so-called scope of practice. Now, you have to ask, who's designing the so-called scope of practice, and what's their track record? What have they been able to do? As an example, there's a guy called Martin Seligman, who's the founder of so-called positive psychology. He's written a number of books, and one of them is called What You Can Change and What You Can't. Now, the book has some useful and nice ideas, but I think it's just about the most arrogant book title I could imagine, because what Martin Seligman is doing is that he's essentially, he's taking what he knows to help someone change, like what he and his colleagues knows how to do, where they have good solutions, and he's projecting that to be like the gold standard of what's like humanly possible. And I think that's supremely arrogant. Of course, he probably doesn't perceive it that way. But Martin Seligman's limitations and what mainstream psychologists know how to do are namely that. They're Martin Seligman's limitations. They're not necessarily representative of, what a given individual might be able to do, or what might be humanly possible. So, on the topic of schizophrenia, now, schizophrenia is, of course, not a medical diagnosis. I know it is the sacred symbol of psychiatry to a large extent, but the diagnosis is not based in any real medical testing. Now, I'm pretty sure that it is true that if you were to work with a bunch of individuals who all had the label schizophrenic slapped onto them, that would probably be, on average, more difficult than working with a bunch of people who have the label phobia slapped onto them. Even though we should acknowledge that even the World Health Organization has found that people with the schizophrenia diagnosis are way more likely to succeed and do better and have so-called remissions in the third world than they are in the first world. So that's something to take into account. Also take into account the old Rosenhan experiments from the 70s. You had this psychology professor by the name of Rosenhan who took himself, and I think it was either 7 or 8, I think it was 8 of his students, and they went to different psychiatric hospitals, and they all said the same thing to be able to do an experiment. They all went up to the door and said that they heard a voice that said thump inside their head. Like, that's all they did. Now, all people, including Rosenhan, were hospitalized, and they were all given a schizophrenia diagnosis, except for one person who got a bipolar diagnosis. And all of them had a rough time getting out of of the various mental hospitals. I think it took Rosenhan about 2 months to actually get out of there. Now, the interesting part is that quite a few of the patients kind of suspected that these guys were faking it. But the professionals who were invested into the belief system, bought it hook, line, and sinker. And it was kind of like a double bind, because if they protested their diagnosis, that seemed to reinforce the diagnosis. But if they went along with the diagnosis, of course, that meant doing even more of the drugs and the treatments. After getting back out, Rosenhan went to the media. I think he'd alerted the media before this too, but he essentially pulled the plug on the whole thing, which kind of resulted in psychiatry getting a black eye for a little while. And then the psychiatrist kind of countered and said, look, we know who's nuts and who's not. We have the ability to distinguish that. And then Rosenhan lied as part of an experiment. He said that there were a bunch of other people that he had sent to these various mental hospitals to. And within the next couple of weeks, I think 30 or 40 people were released, on that account. And then he went to the media again and said that he hadn't sent anyone else. So another black eye to the field of psychiatry. So these diagnoses are nothing to really take that seriously to begin with. They're not like a medical diagnosis like cancer or diabetes or something like that. But so common wisdom would say, look, stay the hell away from someone with that type of diagnosis. And I mean, for legal reasons, it's good advice. They're often on drugs. If you're not one of the psychiatrists, your ass is in the firing line if anything kind of goes wrong. But I worked with a guy a couple of years ago who had almost killed someone once. He'd been hospitalized for 2 years, and he was violent towards his girlfriend, and he had a schizophrenia diagnosis. And he came to see me for anger management work. And of course, someone who's been hospitalized for 2 years and has a severe schizophrenia diagnosis, on paper, that sounds like someone that you shouldn't work with. But in case, he's one of the easiest clients I work with. Like, he got the ideas really quickly. He had some huge insights. He had some huge insights into discovering that it was his masturbatory thinking, his demands that other people understand him and that the world be a particular way that really generated his anger. And he didn't have that many hallucinations, but he got enough insight into the nature of thought that he was able to see that when he started having some funky thinking, he was able to see that it was thinking, and to view it as a signal to kind of, rest for a little while or not take it too seriously. I only saw him twice, and I got an SMS 6 months later where he credited the stuff that we did together to be absolutely life-changing. Now, am I claiming that, everyone with that sort of diagnosis would change that easily? Not at all. But if I were to be an evidence-based practitioner who worked within my scope of practice as defined by the high priests of academia, I would never even have touched such a client. And this was a client who felt that the help that he had gotten within the psychiatric system had not been much help at all. Now, another client, so this showed me that even with all the madness, there was access to sanity in there that we could tap and that we could hook into. I had another client who taught me something of value as well, and this was a client who was not psychologically sophisticated at all, very simple in her thinking, in a sense. Not retarded, but kind of dull in many ways. And it was hard to have like a coherent conversation with her. Now, these sorts of clients, of course, can very often be very tough to deal with. But she also turned out to be one of the easier clients I've had in recent years. What we ended up doing is I ended up essentially just telling her stories and telling her metaphors, and she would relax, and I would kind of paint pictures for her, and all the stories went in the direction of helping her essentially to see that what she experienced was her own thoughts taken form moment by moment. And as soon as the thought stopped, the experience stopped, and that there was a calm and a peace, beneath the thoughts. And that whenever her mind slowed down, she would usually have access to more clear and more fresh thinking. And I saw her periodically over several sessions, and she was not really able to that much verbalize what she had learned or what was different. But she made huge changes. Like a lot of these fears and compulsions and obsessions just melted off of her. And the one thing that she did say is, I used to have a lot of thinking, but now it's for the most part pretty quiet, and I don't buy into it that easily. So this also showed me that even if someone might not be able to verbally, explain much or have those conversations, they can still sometimes make profound changes. And even a person who, just like the schizophrenic, who may be labeled as crazy in a sense, had access to a lot of sanity. Now, this particular woman, who I'm sure if you'd done an IQ test or any of these types of intelligence tests, she probably wouldn't have rocked the scales. But there was another form of intelligence operating within her that was just awesome. And she made changes and insights way faster than a lot of people who probably would have rocked those particular scales of conventional intelligence. So beneath the dullness, there was a lot of intelligence and a lot of capacity to make changes. Of course, none of our conventional tests for intelligence maps onto or has any way of really measuring people's capacities to make these sorts of changes. Consider, for example, how some people can change allergic responses, some people can change autoimmune responses, some people have had changes in cancerous tumors and stuff like that as a result of having dramatic transformations of consciousness. If you want to read up on that a little bit, you can take a look at Getting Well Again by Carl and Stephanie Simonton, who did that type of work with a bunch of people. Or you could check out Radical Remission by what is her name? Kelly Turner, Dr. Kelly Turner, for some cases studying this. So, for example, that psychosomatic plasticity, for example, the ability to change your physiology, or to be able to crack the code in terms of how to make a deep change. There's nothing in our conventional intelligence tests that would ever map onto or predict who might be able to do such a thing and who might not be able to do such a thing. Is it easier in general to work with a person who's perhaps more educated and more intelligent in the conventional sense? Yeah, it is. It's easier to work with people who are more, psychologically oriented in general, as a group. But you really want to give people a chance, and you really want to see people as individuals, and to realize that there's a lot more to people, a lot more resources and capacities to people that any diagnosis or any conventional test or any set of criteria within a diagnostic system, within a so-called evidence-based practice, whatever allude to. So by all means, have a roadmap. Do listen to science, do collaborate with people, do your experiments, but take it lightly and sometimes deliberately choose to ignore those things so that you can figure out some of the stuff that might be outside of those things. Don't let the high priests of academia define on your behalf and on humanity's behalf and on your individual client's behalf of what might be possible and what might not be possible. That's still pretty much up for grabs. So I hope this was somewhat inspiring and useful. Till next time.